Hey everyone, and welcome to the Hospice and Palliative Care Virtual Grand Rounds.
Oh, and I
It
need to bring
is
it back because I don't want.
it is somehow April already, and I hope no one got fooled too badly yesterday. And if you did, I hope you can laugh about it today. If this is your first lecture here, you can get CME credit for free through the University of South Carolina. You just have to create a CME profile through the university at this website, the bit.ly/HAPCCME, which I just put in the chat. This lecture will be available on the website afterwards. And if you're watching asynchronously, hello from the past. Really excited today to have one of my, I'd say my older friends in hospice and palliative care. I think, not in terms of age, but in terms of length of relationship. Dr. Lina Toledo Franco, here talking about communication strategies with the difficult family, with difficult in quotation marks. I think we all have our opinions about what happens and what other teams may consider a difficult family. And I'm excited to hear from Dr. Toledo Franco about this. So a little bit about her. She is the inaugural Division Director of Palliative Care at SSM-Saint Louis University Hospital, Program Director for both the Hospice and Palliative Medicine and the Geriatric Medicine Fellowship. She attends for geriatric medicine. She's the medical director of the Caris Hospice and is the SSM Health Director for palliative care for St. Louis and the Southern Illinois region. She has had a long and storied career practicing at Yale, practicing in Bogota, Colombia, where she was born and completed medical school. She has been widely recognized for her achievements in teaching, scholarship, service, including most recently the SLU School of Medicine Excellence and Professionalism Award, the St. Louis University Hospital Caring Physician Award, and the Leonard Toe Humanism in Medicine Award. She is a patient-centered physician, and outside of work, she enjoys spending time at home with her family, her cat and dog when she visits Colombia, and doing everything St. Louis has to offer: theater, music arts, crochet, cross stitch, and embroidery. Dr. Toledo Franco, thank you for being here and welcome.
Thank you so much. That presentation sounds so good in your voice. Like it just sounds like I have accomplished so many things. I'm also happy to say that actually yesterday, and I hope this is not an April's Fool joke, but yesterday I got my letter of promotion for associate professor. So there it is. So I'm going to share it with everybody because I'm really excited about it. So as you saw, I have too many hats, but one of the things I'm really proud about is besides working in Jerry, I had work in patient experience, and I think part of what I'm going to share today is about my experience, just putting all together palliative care, patient experience, and geriatrics, and how to address those patients who are. I don't want to, and you see the difficulties in quotes because it's just not challenging either. It's just people who are going through a different time and are just manifesting their concerns in a different way. So let's see. And let's just start. I'm going to talk a lot. I cannot see the chat, so Ben, you're in charge of that. If any questions comes, just let me know. I want to make sure that you know that I don't have any relevant financial relationships to disclose. I'm not going to talk about any medications, no treatments, nothing like that is going to be discussed today besides communication skills. That's all we're going to be talking about today. So our objectives for today is, well, one, recognize how conflict with family members can affect patient care and provider well-being, learn the ways to approach conflict in the healthcare setting, and discover some tricks to improve your negotiation skills. So I started working on this, and this is a presentation I did a few years ago, and now has some twitching. But when I started is when I came to this patient's room, and this was at the door. And this, of course, made me think, I'm like, oh, now we know what I'm dealing with. Like, this is going to be so hard. This is going to be difficult. And of course, every time you go into a room, you already have talked with the team. You already have talked with the nurses. You already have an idea of where you're going into. So that's one of the first advice I'm going to say today is don't don't take anything for granted because things can change and there's a reason, and always just give them a little bit of kindness and just see that yes, that difficult family has a reason to be difficult. So it's how we can just keep our part of what we have to achieve, but also try to understand what they are. So when I started looking, and I said, like, I work on this years ago, but when I started looking, actually in the internet, there are a lot of things like how to deal with family members, how to deal with this. But actually, the target audience for all these things were nursing, like nurses and nursing training and how to do. And of course, there are the ones who are at bedside all the time, and there are the ones who actually are seeing this more in, but there was really nothing for physicians that I could find. So then I said, like, okay, let me start investigating. And then I got into these books. One is How to Argue for a Cat. And a lot of the things I'm going to be saying today are a lot of I have learned in palliative, but also this book helped me. This one, the Chris Voss, if you have the opportunity to read a book, it's amazing. I actually listened to it and it's better when you hear his voice. He is an FBI retired agent, so he does have a lot of tips that are very useful in the real life. And actually, one of the things I realized is a lot of the negotiation we do has a lot of to do with what they do in the FBI. It's just a little bit the attitude, which is different, but not even that. So a lot of my time is going to be based on this book. And then I did have at the end, you're going to see all the resources I used, but pretty much it's going to be, so it's going to be a lot of just negotiating skills. So one of the things we have to start thinking about is like actually any human interaction is a potential for some degree of conflict. And actually the way we just address those initial first minutes is what is actually going to help us. Does it develop in conflict, or is something that just pass along and nothing happens with this? And actually the hospital setting is even worse because it's one of the most stressful places. Patients don't really want to be there. Families don't want to be there unless you're going there to have a baby. Otherwise, you really wouldn't like to be there. You would like to be somewhere else. People don't really choose to be in the hospital. So it is a difficult time for everybody. And that's why we kind of label people. And sometimes it's just to scare people, but we label them an obnoxious, demanding, annoying, clingy, and Tyler. You have heard all of them. We all have said all those words at some point. So, and also all the things, those challenging interactions are not also only the anger ones. There are also like those who are awkward or uncomfortable, which we have all the time. And we get into a room and we're having like challenging conversations. Complexity of health care contributes to this risk. Like there is a potential of just developing this conflict. And yesterday when I was going again through the slides, I did erase a lot of those risk factors that actually make the hospital encounters or the healthcare encounters even worse. But there are too many rules. There are rules that people don't understand. There's a lot of fear. There's a lot of scare. There are a lot of feelings involved. And also it's a setting that a lot of people don't understand. So all these things contribute to actually be a very high risk potential for conflict. So one of the things, and the first lesson here is just like actually look at conflict as something that you can gain something for. It's an opportunity to grow. Problem here is you probably wouldn't have a do-over, so you have to do it really well. But one of the important things is, well, not everything is going to go perfect. We know that in palliative medicine, not everything goes as we wish they go, but we learn, and we learn from the next one. And that's why it's so important to debrief when we have these kind of interactions. There's nothing out there that is an evidence-based guideline. As I was telling you, there are a lot of things for nursing, and they're pretty much just like recommendations, and things are very just subtle, but there's nothing evidence-based guideline actually how to manage those challenging interactions, or even a standard care recommendations for that difficult and hard to negotiate moments. So actually one of the things is learn to anticipate what is going to happen. And a lot of what we're going to talk about, and at the beginning you're going to see, it sounds a lot like this bar, like when we talk about the spikes. It's a lot of the beginning was like, oh, this sounds very similar to the spikes because that's what kind of negotiation is. So you will see, but you will see also like other tricks there. But we should be able to actually anticipate this. We should be teaching our learners, medical school residency program, how to actually deal and how to actually be able to. The only time I started to learn about how to deal with conflict when I was doing patient experience, and it was because I was the one sent to the rooms to try to calm this family that was completely mad at everybody else in the hospital. So how can we avoid to get to that point that we actually have to look at security to just come and calm down to that person? So one of the things, and every time you get encountered and sometimes it tells you and you're going to go into the room and they tell you, oh, this is a very difficult situation, this is a very difficult family member, this is a difficult patient, just take a minute and say like, well, if I was in the same situation, would I be considered a difficult family member? And of course, we who are in the healthcare setting, that happens. And sometimes, and we'll have experience like when we have a family member that is in the healthcare setting, it's kind of like, okay, we know we'll have to act differently because that's what happens. So just think, step down and think a little bit and say like, well, in the same situation, how would I react? Because that can, and one of the things you're going to see here is the way you get into that room, the mindset you get yourself to actually have this conversation changes everything. So if you have the right mindset and have like an open attitude, it does make a huge difference. So let's talk a little bit about definitions. So one is disruptive behavior. So anything that gets involved in just providing a safe and effective care. So it can be interfering with the treatment plan, yelling, cursing, using profanity, excessive questioning, just not even being mean or harassing or anything, but just that family that just keeps asking questions over and over and over can just be disruptive just because don't let you just continue to provide the current care. So anything that makes you uncomfortable or interfere with patient care should be considered disruptive. Can it be managed? Yes, of course, but then that's what we're learning here about. Assertiveness is that attitude and self-assurance, but not arrogance. So this is where the things start to become a little bit tricky because you have to show yourself as somebody who's sure of what they're doing, who knows what they're talking about, who is in charge of the situation, but also not look arrogant because that's not going to get you anyway. So that middle point. And when I was thinking about this, we as palliative care physicians sometimes are too nice, are too kind. And sometimes you need to be a little bit more like a straightforward too. So it's that balance just to be able to be open for them, but also just set the limits and say like, okay, this is where we have to move now because it's a situation that not everybody's happy about. Saying what's on your mind, carefully choose your words. That's another thing that is very important because words have power and you say the wrong word and that can go in the wrong direction. Matching your actions with what you're saying, just how your body works, how you're showing, how you're talking, that is going to also show a lot. And being respectful towards the other person, no matter how disrespectful they are. And it's a learned skill, like everything else in palliative care, like communication. Communication is something you learn. It's something you have to practice every single day. And we continue to practice and we continue to learn and we continue to have it wrong and have to do it again and try to do it better the next time. So it is a learned skill. And then the other definition is conflict. So it's that disagreement within oneself or between people who has progressed and can cause harm and has potential to produce harm. So not all disagreement can lead to conflict, but it has the potential to, and it depends on how we manage, and we're going to talk about that in a little bit. So perspectives, beliefs, expectations actually influence that transition from disagreement to conflict. One of the most important things, and actually the trick for patient experience, is how to manage expectations. When we're able to manage expectations for anything, the outcomes are going to be better. Because if you're expecting something and that doesn't happen, then that's going to probably lead to conflict. So since the beginning, we're able to actually set the expectations, that helps with the outcomes. So this is it. So these are the phases of conflict. So first you have your stimuli, and that one leads to frustration. It's a stimuli that is strong, it's imperative, it just raises a lot of emotions and just catches our attention. It can be unavoidable. Like there are things that are going to happen no matter what. It's a stimuli. In the medical practice, there are a range of common sources of conflict. Like, again, as I said before, we have prohibitive environments. There are organizational barriers. You cannot smoke there. This is a non-smoke place. And that's something that for somebody who really wants to have the cigarette is going to be the stimuli that leads to frustration. Then we have different cultures, values, priorities, expectations. Like people is taking those rules, those events different. Prior experiences, communication barriers, and the lack of skills. So it's going to be, and just going back to that person who wants to really have a smoke in the front of the hospital is also how we approach that, what is going to actually create or not. So first we have the stimuli. After we have the stimuli, people what do, and this is just reaction, we want to find the cause. What's the reason for my frustration and what's the cause that produced this? So it can be precipitated, it can be inaccurate. Like I'm just going to find a reason for this. I'm just going to find who's guilty for this. I need somebody to blame. So every person is going to be involved different in this type of conflict. And it can be erroneously perceived. And again, it will depend on what's in my mind. What am I feeling in that moment? Why I have reacted to this before. And then the third one is the expression. So I had this time a stimuli, then I had like my only process and my mind process of just finding what really happened and why I'm so mad about it. And then my expression. So that behavior is directed towards whatever I think is the cause. So the idea of this is just actually, I'm going to crystallize that frustration that I have. I'm going to just do something about my painful thoughts. The worst possible outcome from this is destructive behavior. Other expression can be just like, I don't care, I'm going to turn around, I'm going to just turn off the cigarette and just keep away my life. But there's the other one who's just going to just like explode and start just kicking the walls. So one of the important things to do this, you can actually modify the outcomes if you actually let a lot of time between phase 2 and 3. So if people actually are trying to find the cause and are trying to find somebody to blame, but before they explode, they're able to calm down and kind of think this again, then they are less likely to have a worse outcome. They're less likely to just like explode. So that's why it's so important to see where we approach this and how we can approach this. Just try to decrease that conflict. So the outcomes, as we said, the worst outcome is nobody gets what they want. We have conflict, we try to just agree, nobody gets to agreement, nobody got what they want. The less favorably is only one side win. The most effective is, oh, we all win. We came to an agreement, everybody's happy, and we found our common ground. When constructive conflict occurs, then there's growing, the problems are resolved, everybody's happy, we just grow from here, there's commitment, and we get to a plan that is going to just continue from now on. The harm conflict resolution, then the problem is going to be just, there's going to be negative. There's no moving forward after this. There's no resolution of the case. Something has to happen to be able to start all over again. So a new attending comes in, a new family member shows up, the clinical condition changes, but something has to happen to actually go back to start that conflict resolution again. So here is one of the ways to deal with conflict. And when there's conflict, they have to be 2 teams or 2 people. Hopefully it's 2 people, so it's easier to negotiate. But sometimes we have those families that are huge and they're like different parties over there. But let's say like when we're talking about like ourselves and the other ones, and then how we deal with conflict will depend on how strong we feel about our own position and the other ones. So, and there's no, you can use them in different moments. So one is, I really don't care so much about my opinion, but I don't really care about the opinion of the other one. So that's when I avoid the conflict at every cost. I'm just going to avoid this. So it can be usually like, is this battle worth it? And sometimes I said that, especially when I take care of my dementia patients, there are things that you don't want to engage in. Just avoid that. Don't get engaged. Let the patient be. There's going to be okay. Like things are going to just kind of just like be forgotten eventually. Nothing is going to go. There's no reason. There's no big consequences. So we can just let this go. It's not good when we have a long-term goal. If we have something that this is going to, like, I ignore this at this point, I ignore that conversation, I avoid that conversation at this time, the problem is going to continue to grow. That's when we should avoid this. So the other one is, I think a lot of myself or what is important for me, and I don't really think about the other one's position. So it's just competition. It's just I need to win. I need to win this one. It's useful when you really have to make a decision and there are limited resources. When is good? When the goal is to win, when you really need to win this. Worse, when the goal is to cohese the group, because probably this is going to create some conflict and people are not going to like it. And it's more like an authoritarian, but sometimes you have to do it. There are like rules and it is, and that's what parents do a lot of time. I'm like, oh, I'm saying this, and that's it is because I'm your dad. And we're doing it because I'm saying so. And there are things and there are rules that have to be made. You have to fill up that form. It has to be done. You can discuss as much as you want, but the result is going to be the same. You have to do it. So there's no communication here that's going to change things. So that's when things are more like settled by rules. Then the other one is when I think a lot about the other one, I don't really care about what it is. It's like, I'm going to accommodate this. This is something that I don't really want to invest too much of it. It doesn't really change the outcome if I give up, let's put it that way. So when you need something that needs like really resolution right now, so when what the other ones makes more sense, like really, this family is gonna do better in the grieving process if we continue to do this. Let's give them more time, 1 or 2 days on intubated or 1 or 2 days more antibiotics probably are not going to make a difference in the big picture, but it's going to help them. So it's okay. We can negotiate. We can accommodate that. I'm not going to take that one. I'm thinking more like the big picture, and it doesn't matter at this point what my goal is. And then the best one is when we can just collaborate. So it's high self and high the other one. We're trying to satisfy all parties. It's really good when the goal is long term and you want to make sure that this is respected and everybody's happy about it, and it's actually the outcomes are going to be good. But it is not good when actually you don't have the time to have that conversation and to get to just everybody to be happy and have that conversation, because to get to the collaborate part, you do have to have time to have those conversations. So one of the things, and I really enjoyed this slide when I did it, and you can tell it was a few years ago, but one of the important things is actually whose goal is it anyway? I'm going to go in here to win, or I'm going to go here to listen and understand where they're coming from. And this is one of the most important things in palliative care. And it's just like, well, this is not about me. This is not about what I want or what I think is right. I'm here to just support somebody who is in a lot of stress. I'm just going to see and try to show the options and see what it is and how can we get to a agreement that is best for everybody. So here we go to just how to negotiate. So this is the 3 basic goals of persuasion. So one of the things you can do is, so these are the things you should do when you're trying to persuade something. Change their mood, change their mind, and change their willingness to do something. So change the mood, that's the easiest one. It can be just your biggest goal when you start an argument. If you get to that really angry family member, if you get them to be less angry, that's a win. You will have other conversations later, but if you're able to just kind of just calm them down, that will help. And never, and this is one of the key points here, never under any circumstance say, calm down, because you know how it is. And if you're married, or if you're in a relationship, you know how hard, especially if the other person is a woman, if you say like, oh, don't be mad, that just makes things worse. Because this implies that their anger or whatever they're feeling is their own fault and something they can manage. So never say that. Just understand what's going on, but never point it at them. Then the second one is change their mind. That's a little bit harder. And it takes practice. Just like, okay, we're going to do this. This is it. First, we change your mood. Then we're going to change your mind of what you want to get or what you're intended to, or what is that is making you so mad. And then the third one, it's like really expert level, is just change their willingness to do something. So actually take action or making someone stop taking action. The example they had in the book was very political, so I'm not going to get in there, but it's actually somebody who has opposite political views and change their mood. Like they're having a conversation at home and they're talking, and it's just Thanksgiving dinner, and they're really having a conversation about like the political environment, and they initially somebody comes and says like, okay, let's change their mood, and that's fine, and then we continue talking about other thing, change their mind. It will be like, well, I'm gonna make you actually to change what you believe about your political person you're following. That takes a little bit more practice. And then the other one will be like, well, okay, now I'm going to change your willingness to do something. So now even you're going to vote for my candidate next time. That's the huge one. That takes more time. That takes more effort.
I just connected to.
Okay. So how do you deal with conflict? And I love when he said this, and it's like emotional intelligence on steroids. This is where actually you show your emotional intelligence and your communication skills all together. So first, and again, that's where we start talking a little bit about like how this correlates with spikes. So prepare for the encounter. Understand that we are irrational, crazy, impulsive creatures. We're gonna actually react with feelings. That's our instinct. So negotiation, even though you prepare, just make sure that you know in your back of your head that it's going to be unpredictable. It's going to be full of emotions. You don't know what is going to happen. So be prepared for the other outcome. Scripts don't really work. If you just have your script and you want to just repeat it, and you probably know that by now, they don't work. But they give you confidence because you feel like you got there prepared. And showing them that you're prepared and that you have confidence is just half of the win. Have a mindset of discovery, and this is good for anything in palliative care. Negotiation is not a battle. You're not here to battle, you're just here to learn about themselves. So we're again, whose goal this is anyway. Ignoring the conflict will not help. You can actually delay it if it's too much, but don't ignore it because that just builds up and builds up. Stop and evaluate the situation. Convince yourself that you like your audience. So this is a really important one, and I have started using it a few years ago, and it does help. Think about that person you're going to have the conversation with, that person that you need to negotiate with about something you like about this person. It can even be their shoes. It doesn't matter. But if you come with that, like there's something I like for that person, your brain is going to take it like, okay, we're in a safe environment. We're in a safe situation. We can actually make them more bearable. We have something in common. Again, even if it's their shoes, we have something in common. In our situation, it's usually the patient. That's what we have in common. We want the best for that patient who's lying in the bed, or that patient that can talk. So find that common ground and make yourself and make your brain understand that you like that people who's there. Even if you don't like it, then when they make you mad, kind of think of change that mood, because that's going to change the mood of others. Second, find the right setting. Quiet and private place where you feel safe and comfortable. Remember, it's not only them that you have to make sure that they're comfortable, that they feel safe, but you also have to feel safe. You also have to be prepared for these conversations. Observe the situation. So always and continuously read the room. And there might be a time that you need to finish the conversation, and that's okay. That can happen, that's allowed. Just make sure that you are in the right place and they are in the right place. And you're getting some. Sometimes you're not gonna get anywhere in the first meeting, so just have another meeting. So like I will come back later and we can continue with the conversation because your time is also valuable. Demonstrate basic manners. The usual, I'm not just gonna stop it there, but it's pretty much just ask permission and be nice and knock the door and be just respectful. Remain calm and professional. And then minimize fragmented communication. And that is hard, especially in big hospitals, big academic hospitals, where there's like so many teams. And then there's so many family members and they come and they go. So let's try to find that moment that we can actually all sit together. And that's why family meetings work so well, because we can just sit and have everybody on the same page. Then the timing. So it has to be the right time. And it was the right place. It has to be the right time for the other person and for you. So if everybody's screaming, everybody's yelling, slow the process, allow everybody to calm down, and just restart again. If negotiating goes too fast, people feel that they are not being heard. So calm down before you even confront the other person. Nobody is going to be persuaded if they're not ready to be persuaded. So they need to change the mood before they actually can listen to what you're saying. So if they're mad and screaming and yelling, nothing is going to happen. At that time, you're just going to reassure them, listen to them, and kind of find that common ground. And that's what you have to do at that point. but also don't wait too much because the opportunity fades out fast. 4, work on your ethos. And by ethos, it means your character, your appearance, that you're showing. So be virtuous. I really like that person. I really like that person. I really feel like comfortable talking with this person. So just be caring. So put the other's interest in front of yours. So you need to find out what they want to know, to what is their interest. Again, a lot of the times it's just they want mom to get better and they're just very scared because the food is always cold and mom likes warm food. So why we cannot do it? And I'm sure this is a complaint that you hear everywhere, because that's the other thing, a palliative care specialist, we are the ones to sit down with them and hear a lot of the things that nobody else is listening to, and they feel open to talk about those things. So sometimes all they want is attention. Sometimes they just want to just feel like somebody listened to what they had to say about the food. Then craft. Make your audience believe that you're really good at what you do and what is important. That's called practical wisdom. So, and we're back to just that confidence and just feeling like you know what you're talking about. You know that you're here, that you could provide some help. And that's why you're here. And you have all the skills that are needed for that. And then the cause or the virtue. So just make sure that you remember that you're standing for something bigger than yourself. It's about values. It's about honoring, and here they call it audience because that's what you're kind of negotiating with, but it is just honoring your patient's values or your family members, or like, what are we actually doing? What is the big goal here? Nice and long is not enough in negotiating. You actually have to be very straightforward. You have to be virtuous. You have to care, but also you have to know what you're doing and you have to show what you're doing. So your nonverbal actions are very important. Your body language, your facial expressions, your voice tone, and that level of assertiveness. So your posture, as you already have heard and know, and at this stage, is just, even if you don't feel confident, fake it. Fake it till you make it, because it does help. And they don't know if it's real or not. So just sit up straight. And that will help because they feel like you actually own the room and you can own that conversation. You also want to avoid that you're trying too hard. You don't want to like, oh, I'm trying. I just want to please you. I just want to see like, are you okay? How can we make it? No, it's still like, I'm here for you, but I'm going to still keep my role and just be nice, be kind, but still be straightforward. Maintain a friendly facial expression, make eye contact. I cannot express this hard enough. Like, it's just how difficult it is when actually you look at people at the eyes, especially with the patients. Use calm voice and speak assertively. So the voice is your most powerful tool in verbal communication. The tone of the voice is actually going to help to flip that emotion in the other person's brain. And actually, audiences respect more a deeper voice that does not change that much. So that's the late night FM DJ voice. So if you can just imagine one of those like late night radio DJs, just very deep, soft, reassuring. They just talk very deep, very slow. They take their time, and you feel like that voice is soothing. It's just like it doesn't have those changes. And one of the things I was learning the other day is actually the brain, like anything that is just stable and doesn't really change. The brain doesn't react good to changes. So that's why it helps. So that's soothing voice. And that voice comes way easier if you're sitting down. That's what sitting down actually helps. There's also other type of voices that might help, and it will depend on who your audience is. The other one is the positive and the playful voice. And it's just that one that you want, like, oh, easygoing and just like a good natured person. And it just helps when you want to make things lighter, when you want to make the encounter light. So you just relax, you smile while you're talking. And even if you're on the phone, actually, studies have shown that even when you smile over the phone, that has an impact in your tone. So if you want to just be that reassurance person that you're smiling, that you're accessible, a little smile helps. And actually, when you smile, that also changes your brain and just feels like more in a positive attitude. And that helps even the smiler and the smiley. So that also is important to know, like, okay, what is the moment I'm going to use my DJ voice, or when it's going to use my more positive, playful voice. And it's going to be just when you read the room, you know what you're going to be needing. And the other one is just that direct and assertive voice. This is what we're doing. I don't care what you think. it doesn't really help. So it's usually very, very limited scenarios, not recommended to use in the setting of conflict because it's not going to work. But if it has to be, if it's a rule that cannot be broken, then you cannot be here. There's a rule. You cannot be here. You have to get out of here. Well, probably that's the assertive voice you have to have. And at that point, a playful voice is not going to really work. So it's just all about the setting. And then your body language, put a smile on your face. When we radiate calm and acceptance, actually the conversation flows better. Just to start with a smile. Unless somebody's really angry at you and then you smile and then but it does work sometimes. Just show that you're there, and that tells them you're not here to fight. You're here to just open a conversation. You just want to make sure that everybody's okay. Leaning back or stepping away shows distress. Getting too close is going to be threatening, especially in this situation. So stay away, also for your protection. Stand up or sit up straight. Recommendation is to sit up unless the other person is not sitting down. Hold the head high, maintain a good posture, relax your shoulders, stand with equal weight on both feet. Don't move. Allow your hands to fold naturally or fold them in front in a relaxed position. Anything that shows that you're relaxed. I do better when I'm sitting down because usually when I'm standing, I tend to cross my arms, and crossing the arms is not a good idea. So that's why also, besides everything else and all the evidence that is there, I really like to sit down. But again, it depends if the other one is sitting down or not. And stay away about 2 feet from the other person. Other things about which I'm sure you already have heard many, many times. Stoop shoulders show lack of confidence. Fidgeting with hands shows anxiety. Hands on the hips are aggression and impatience. Arms crossed in front of the body is defensive, is frustrated. It's I'm trying to protect myself. While gesturing is anger. So also this helps to read the room and see where the other person is. Open arms make you look more open to the conversation and hearing. And actually, one of the things they said always is just like, look at people like you're like, especially at the end when you're closing conversation, open your arms, palms facing up, like you're actually offering a hug. Not that you're giving a hug, but you're offering that actually just disarms the other person. And not frequently. So, of course, as I said before, eye contact, but this is some of the things that, yes, we know, like looking down is shame or avoidance, tilt, confusion, misunderstanding, pursed lips is anger or distrust, looking past you, distrust, guilt, frequent blinking, discomfort, for hours, anger and discomfort, raised eyes or interest. So just remember, this is very important for you because this is what you're transmitting, but also this is going to help you to actually read the room and see where your person is. So in summary, just be like a pineapple. Stand tall, wear a crown, and be sweet on the inside. So that attitude really, really matters when you're discussing this. So the next step is just listen without judgment. Get the understanding how we got here and why you're so angry or why you're so conflicting or why you're so difficult. So it is very cheap. And it's the most effective tool, and it's not a passive activity. And that's one of the things that was harder for me to understand when I was starting to do palliative care. It's like, actually, it does need a lot of your energy to just listen, but it helps so much, and it just gets you where you are. If the family is angry or emotionally intense, don't talk over, don't interrupt them because it's going to make it, just let them. If it's getting to a point that they're talking over 15 minutes and you're not getting anywhere, and then at that point say like, okay, let's stop here and let's try to recap. But otherwise, the first 5 minutes, let them just talk without interrupting. People wants to be understood and accepted. That's when we use the tell me more, help me understand. I'm trying to see why this happened so we can resolve this issue. So they said that you have an interest in what they're saying. Even if you cannot resolve it, you want to listen what this happened. And then you can just actually offer something like, let me see how this can be resolved. Let me see if there's anything. Let me see what happened. I mean, there's something we have to do about it. Avoid questions that can be answered with a yes or tiny pieces of information. You want to ask open-ended questions. And actually playing dumb, it's a really valid negotiation technique. Tell me understand. I don't understand. Please tell me more. The goal is to identify why your counterpart needs and get them to a safe point where they wanted to keep talking. So you are able to validate their emotions. So you ask calibrated questions. And that's what we call open-ended questions. Like actually it is. It's just like you're asking a question, but you want to get more than one thing from that question you're asking. It also buys you time. And then actually you kind of start like putting more things in their mind. This is what you want. How am I supposed to do? How do you expect we can do that? Or what do you think can happen for that to happen? What do you think we should do for that to happen? Family members often begin to seem demanding because they are afraid, but don't assume they're afraid. Just ask what got you them. Just have multiple hypotheses and just questions to actually just make sure that you got to the right answer. And evaluate what are the expectations, what they really want to get from this. So beliefs usually comes from two sources, experiences and expectations. So what happened as an expectation? In the terms of persuasion, expectation is the same as the truth. This is what I expect to happen. This is what is going to happen. And if it doesn't happen, then everything else is going to be wrong. So you need to know what those expectations are. And if they had prior experiences, what are those prior experiences that have led this? So be mindful about content transference. Like, yes, like what they're saying doesn't really make any sense. And I have learned to just actually be able to just measure and understand my responses. Ask calibrated questions, how and what. Avoid as much as possible the question with a why. Because why can sound as an accusation in any language, like why you did this, instead of like, what do you think happened? It's completely different. The why goes more toward an accusation. Avoid using the words never, always, never, then here we go. Open a conversation with the word you. This is not about you. This is about the situation. Humor and humanity are the best ways to break the ice, but that's one of like, you really have to know how to do it. You really know how to get there. You really need to feel safe using humor, and it has to be in the right setting and with the right person. So it does take practice. And touching is a great way of providing comfort and support, but also make sure that it's welcome and it's culturally appropriate, because otherwise you will get in trouble. The next one is just understand and validate the subjective experience and concerns. So offer empathy. So feel them like, okay, now I listen to you. I know where you're coming from. Now validate what you have done. So I listen to you. I understand. Now I'm telling you, okay, I understand where you're coming from. I can see how difficult this has been for you. Let me make sure I hear you correctly. So actually in that reframing, you can put everything in context, so they really feel that they have been heard. Be the adult in the room, be respectful for them. So one of the important things is with empathy, you don't have to agree with the other person. You just have to understand what's going on. Agreeing with the other person is sympathy. Feeling the same thing that the other person is sympathy. You don't have to be sympathetic to be empathic. You just have to understand where they're coming from and acknowledge their situation and listen to what they have to say. So that's tactical empathy. So understanding their feelings and hearing what is behind that and hearing what the feelings are. So always remember, decision-making is emotional, not logical. And we do have a lot of families that want the little detail and what was the creatinine this morning, and they're writing everything down. But at the end, they're also making the decisions with their emotions and with what they feel. Phrases of apology don't necessarily make acceptance of guilt. And that's something that's also very important. You're taking the responsibility of trying, and I have here fixing the conflict, but you want to try to fix the conflict and make sure that there's a relationship. I am sorry, and maybe you don't have to say I'm sorry about this that happened, but I'm sorry how it happened. I'm sorry this seems too much for you. I'm sorry we have to be talking about this. I apologize for the misunderstanding. I will look into it. And actually, I will look into it. It does help a lot. Mirroring. The brain wants to copy what the other person is doing and what the other person is saying. So that's what they're trying to comfort. That's what we do. We try to just find a safe place and just kind of just mirror that. And in negotiation, body language helps, but it's also is mirroring what it just has been said. So when you're having that person that is just very angry and just telling you true things, you just know what they said. You want to just provide your assurance. Repeat back what they said. Use the last 3 critical words and repeat it. Say it again. This is what I heard from you. So now they actually feel like, okay, this is crucial. This is it. I'm just being listened. I'm being acknowledge. And it works better than positive reinforcement. So it is the equivalent to help me understand, because now I'm like, okay, I'm telling you, okay, this is why I understand. May I repeat what you just said? And then be silent after the mirror and let them respond, because then they can correct you. They said, no, it is right. So how to confront and get your way with confrontation is use the late night FM DJ voice. Start with I'm sorry, then do the mirrors, do the last 3 words they said, silence, and then repeat again. And that will just flow the conversation. Label the emotion, diagnose what the problem is. Recognize the difficult situation, analyze it, name it, be clear, simple language, be honest. Acknowledge that you and medicine has limitations. And if the conflict is with something else, acknowledge that some things might not be, or the outcome they're waiting for might not be happening. And recognize what are your own goals on your agenda in this conversation. And let's see if actually those goals and agenda can align with what the patient is and what the family is, and see how realistic. And we'll get to the realistic part later. At this point, we're just trying to get to the same point and understand where we're coming from. And then if they are not realistic, we will address that later in another conversation. But at least at this point, I just want to see if my goals align with your goals. Provide a consistent message. Emotional best practices. That's just it. It's just part of our conversation. It's part of how we react to them. Remember, and this is another important thing when we're dealing with conflict, this is not directed towards you. It's the situation. So they're mad at you, but actually what they're mad is that they're in the hospital. They're having a hard time. They don't know what's coming. They're just mad at the situation. So naming the feeling helps. So it sounds like, it looks like you are very frustrated with the food coming up late. I mean, I use the food one because that's one of the ones I used to have more inpatient experience, but of course, anything can it. It looks like you don't like that you're getting different information for different physicians and you don't know what's going on. That's another one that I hear all the time. And people actually react better when you put it in that way. Like, it looks like you're frustrated. It's very rare that somebody says like, oh, now you're going to tell me how I feel. That happens a lot in the movies, but doesn't really happen in real life. And we also give the opportunity to actually correct you and say like, no, I'm not feeling frustrated. I'm just sad. And then that opens a whole new conversation. Don't use the word I, don't use the word me. It shows that you're more interested in yourself than in the other person. Replace the negative feelings with positive, compassionate solution. And that's when we start thinking about, okay, let's start working on the solution. I acknowledge that, or we acknowledge that we works better. You might be thinking, what else is important to add here? Just keep yourself out of the conversation as a primary person. Then pause. Silence is the most important thing at this point. You already talk, they already talk. Just pause and let them just, all that you have been discussing and talking about, sink in. Read the room and look for normal clues. If the other person is being disrespectful and this has not improved despite listening to them, set up the rules for the expectations. State that physical threats or profane or offensive or racist language or any disrespectful favor is not going to be tolerated. And take the time to decide where your limit is. So before like today, so like, okay, where do I set my limits? What is something that I will not put up with? And then these are things that you can say you have encountered yourself in that situation. So I am willing to listen to your concerns and answer your questions as long as you're willing to be respectful. I will answer your questions and do everything in my power to make sure you get what you need, but I will not tolerate profanity. I will not allow myself to be treated and spoken this way. I am trying to keep your loved ones safe and take care of them. I understand that you're upset. I will leave the room now and come back later when you're ready to speak to me in a calm and respectful manner. You're not being disrespectful. You're setting your limits. And you're like, this is not allowed. This is not right. We can continue these conversations. We have a common goal, but not like this. And then pause, and then you can leave the room and come back later. Master the no. No, it's part of the negotiation. It's the start of it. It's not the end of that. If you hear no, that opens the door to just continue talking. So if someone says no, just rethink what that really means and just to start all over again. What if this doesn't work for you? And that's when we're talking about the patient not getting better in the ICU. What if this doesn't work? What would you need to make it work? It seems like there is something here that bothers you. So just continue with the no and just like have the no. And then after that, ask more questions. One important thing to remember is that people really have the need to say no. So make them say no early. So instead of asking, it's now about time to talk, ask a question that can lead to that no. Do you have a few minutes to talk? Or do you have, so I said it wrong. Instead of asking an open-ended question, or instead of asking something that actually gets answered with a yes, like, do you have a few minutes to talk? You should just make it negative. So they say no. So actually they reply and they use that no. It's now about time to talk. So then it just changes because you want to get rid of that no, and you don't want an early yes, because usually an early yes is not real. Types of yes is that one that is just counterfeit, that is like, yes, it's just to buy time. So they're saying yes, but they actually don't really mean it. The confirmation yes, which is innocent, is reflexive. It's a response to black and white question, but has no promise of action. The commitment yes is the one that you actually want to get afterwards, after a conversation, is a real deal. If you have that the other person seems not to be listening, again, try to ask a question that leads to a no. Same trick they were recommending is like, actually, if you have somebody that you wanna, like, it's not replying to your emails, it's not really engaging in your project, ask a question that leads to a no, because that makes that people just react right away. Have you given up on this project? And you will get a response right away. And then look for that's right. So this is a very important one. You want to see, like, and you're going to start being conscious about it now. But when you're in a family meeting, when you're having this and you hear when they said, that's right, that only means everything you have said sink in. They understand it, they get it, they feel it. Your job is done there. How to get to that's right, paraphrase and label, and then summarize. That's going to get you there. On the contrary, when they said you're right, it's a disaster, because they usually said you're right and it's followed with a very short pause, and they're just thinking about it. Like, yeah, you're right, but I still don't know. I still don't feel it. You might be right. That you're right and you might be right is kind of the same thing. So you're looking for that's right. And then we're looking for the resolution. What is going to be our best solution to offer at this point? So a perfect logic argument fails to persuade. Usually, remember, we talk about people have emotional and people make decisions with feelings. So when you're trying to look for resolution, include those feelings. Put choices and not facts. They use, I'm not a mother, so I don't know, but they use a really nice example in the book. And it says, like, well, when you're actually getting your kids to wear a jacket, you don't ask, do you want to wear a jacket today? You ask, which jacket do you want to wear today? So you're giving them choices to pick with the solutions that already have what you want to offer. So you want to give choices. You want to give options. This will look like this. This will look like this. We have these options. So they can actually pick for something and they actually feel like they're making a decision. Remember your emotional drivers and make somebody actually want the end of it. Like, actually, the resolution is something we're all looking for. Would you be willing to? So it's a really effective conversation when we're talking about time-limited trials. Would you be willing? And we're starting to negotiate. Like, what are your trade-offs? What are you willing to? What do you think you would do if this doesn't happen? And then if you use the word fair, it's really good. It's a very powerful word in negotiation. So this is fair. Like what we have been talking about, the person has been treated fairly. We're offering what we can. The things have been done. Make sure everybody's in agreement with the outcome. I'm pleased we agreed on. I'm happy we talk about this. I'm glad we were able to clarify the misunderstanding. Groom your opponent. Small doses usually helpful. You're doing a great job with taking care of your mother. She has been very strong. She is very strong. You are taking good care. You're good at being her voice. Thank you for being her voice, because she needed somebody that actually is looking for her. Always, and you already have heard this a lot, say yes and instead of but. because that helps also just to make it more positive. So find that common goal and make sure that you share it to set a ground to move forward. We are all here because we care for your mother and want the best possible outcome. I'm sorry you had a bad experience this admission. Let's now see how we can move on and focus on her. One of the important things is if a person believes something is true, it's going to be true until you show them that there's another option. If somebody believes hospice will accelerate the dying process, she or he will refuse hospice even if the evidence shows that actually can prolong lives. So how can you just change that conversation? So start with something that they already believe and they know it's certain. So yes, patient will die with hospice care. And, because remember, we're not using the word but, most likely will die without hospice too, although hospice care will be more comfortable. So you're starting with their belief. You're not changing that. You're not going to say like, oh, no. There's this evidence that says it's not going to take you anywhere. They already have their belief in that. So start with actually with that belief and move forward for it. And just see how can you change your conversation from this. And then guaranteed execution. So make sure, remember, yes is nothing without a how. So make sure that actually people repeat what it has been said. So use calibrated questions, summaries, and labels to get them to reaffirm their agreement at least 3 times. So it's the rule of 3. And make sure you actually just are like actually tell them like how this is important. So end the conversation with a positive note and we'll strengthen the interactions afterwards. We value your opinion. We respect the care you provide. Going forward, I feel we will be able to work through any problem. Just give them, just empower them. Like you already got to the hard part. Seems that everything is going to be now better. I'm going to skip this one in the just light of time. And then just when you're in the hospital, just to a little bit avoid the conflict. In the hospital, try to limit the changes of providers coverage if possible. And that's when we're dealing with families that tend to be more that have more conflict or that just feel like or like complain more. I just don't want to just judge anybody here or put them like on a square mindset, but it's just like sometimes it is. So what can decrease conflict in the hospitals? Limit the changes of providers. So try to have a stable person. That is very difficult, especially like with hospital teams and teaching services, but have somebody who's constant, which sometimes is the palliative care team. Always avoid pejorative language. I'm name calling, even with your closest colleagues. Don't talk about the patients. Don't talk about the families. Just talk about the medical part, what is important, the social part, what is actually going to help to just get to a good end. Identify helpful family members and potential surrogate decision makers as early as possible. Aim for clarity and consistency with the team regarding expectations and consequences. It might be necessary for multiple providers to go at the same time. Family meetings are amazing, especially like sometimes when there are too many people. I always tell my families it's too many cooks in the kitchen, and we try to just put everybody together. Sometimes just seeing them jointly makes a difference. Proactive and frequent communication amongst treatment teams also help. Let them vent their frustration, but don't allow this to continue in the long term. I understand you have had problems before, but let's pass this page and see how we can make it better now together. Debrief with your team when there's a difficult encounter and create plans for the future. Over communicate and plan to spend more time with this family. Head into the difficult room first. Make a small talk and get to know them. Involve the family in patient care. Enter the room with that open mind. And again, think about something you like about this family, you like about this person, you feel connected with. So in conclusion, the first step to avoid using the term difficult. Let's don't use that term. It can be challenging, which is also a word I don't like as much. It's just different. And every situation is going to be different. Learn to read the room. Don't assume anything. Always take time to fully think through the situation and calm down before entering into the discussion. Listen and try to understand. Find a common ground with a family member that is annoying you. Empathy, it's a learnable skill and gets stronger by practicing repeatedly. The person across the table is not the problem. The situation is. Despite the care team's best efforts, there will be few cases where you just can't make much anyway, and that's okay. And those are my references. And remember that life is negotiation, and negotiation is communication with results. And that's me. That's my email address if you need to contact. I don't know if I don't think I left many time for questions, but I'm here.
Thank you, Lina, for the phenomenal talk. It's such an interesting topic because we hear, more than we necessarily in palliative care, hospice, more than we assign families is difficult. That's something we're going to hear walking into the room, right? Or in a consult call, hey, I really need your help with this difficult or challenging family. And I think that that's always a great opportunity for us, isn't it? To
It is.
say they're not, right? They're just, fill in the blank. They're
There's
very detail oriented. They're very worried, right?
It does. I think it helps to change our mindset. I think that's the best part of putting it. And it is. And there's gonna be people who have a harder time than others. That's gonna happen. But it's how we approach them that is gonna make the difference.
That's it. And what a great roadmap you gave us, right? A lot of, responding to emotion, a lot of vital talky stuff in the middle there, naming an emotion, expressing empathy, right? All of those things can help break down the barriers that you're experiencing with these families.
Yeah, what amused me was like this was a lot of it was from an FBI book. Like actually that's what they're learning in the FBI, which is the same thing we're learning in the Vital Talks. I mean, what is we're learning in fellowships. So it's just the communication helps in every setting.
Fantastic. Well, I put the CME code in the chat a little while ago. So if you are looking for CME credit, there's the code that you can text to the number that I've put in there. Um, Otherwise, Dr. Toledo Franco, any last words for the audience today?
No, I think I've been talking for an hour. Um, no, I just think this is a great opportunity. I will say is just that. Is just open your mind and don't put labels, no matter how many times you have felt it, how many times you have heard it. Labels are never good.
All right. Well, thank you for your time today and for this awesome talk.
Thank you, everybody.